Warm welcome to all of you today. And as a part of the 100th year celebration of Sitaram Ayurveda Private Limited, and on behalf of Sitaram Research Foundation, we are holding this CME series every Sunday. And today we have a very wonderful guest, Dr. Manoj Kumar, who is currently serving as the registrar of the Kerala University of Health Sciences. And more than that, he was the HOD of Panchakarma in Ayurveda Shala College in Kottakkal. Even though he has over 22 years of teaching experience and also as a practitioner, more than that, every time you listen to Dr. Manoj Kumar, one thing that is coming to you is he speaks like a scientist. He always questions, why are we doing this? Is this something that we can continue? Or is there another way we can look into it? And today, the topic that we are going to discuss is about Snehapanam. Now, if you read Sushruta Samhita, there is a quote saying, Sneha Saro Yam Hi Purushaha, which means, our body is mainly Sneha. And if you take the good qualities of Kapha, it is Sneha. If you take the prime qualities of Ojas, it is Sneha. And if you see the problems because of elevated Vata, it is actually depletion of Sneha. In fact, Ruksha is the opposite of Sneha. So maintaining a good Sneha level or Snehana level is one of the main methods of Ayurvedic therapies that we do. In fact, the whole concept of Rukshana is in case if there is an excess Sneha, we have to bring it to balance. So we can also say the purpose of Ayurveda, we say that it is to withhold or regulate the Agni. And we can also say the purpose of Ayurveda is to make sure the Sneha is at optimal level in our body. And in Panchakarma, as a preparation, we do a lot of Snehapana because before we clean, we have to prepare the body. And there are various methods we do that. And also there are various methods of oleation that we do to our body. And in today's webinar, we have invited Dr. Manoj Kumar. He has done various research and he's typically a scientist when it comes to Snehapana. And we invite Dr. Manoj Kumar for this webinar and we give the dais for him in this Zoom panel. Thank you, Dr. Manoj Kumar. We are so happy to have you in our webinar series. And now we make him as the host and we continue the webinar series.
Thank you, Doctor. Am I audible?
Yeah, yes, sir. You're very much audible.
So, thank you, Dr. Vignesh. എല്ലാവർക്കും നമസ്കാരം. ഈ 100 വർഷത്തെ പ്രോഗ്രാമിൽ പങ്കെടുക്കാൻ അവസരം തന്നതിന് ഡോക്ടർ സിതാറാം സാറിനോടുള്ള നന്ദിയും കടപ്പാട് അറിയിക്കുന്നു. Entire family, their trustee board, and all officers behind the Sitaram group of institutions. Thank you so much.
Yes, sir. Just to think, sir, since we are having doctors all over India, so maybe if we can also have it in English, it will be.
Okay. See, when the topic came, some friends called me, Doctor, why you are coming with the Snehapana again? That's a true question because I think I have discussed Snehapana in many stages, many venues, many meetings, seminars, and a lot of people might have heard about it. It may be a boring thing. I think in Kerala, as he rightly pointed out, there are people abroad, outside Kerala. Anyway, bore അടിക്കുന്നവർ ഇടയ്ക്ക് കൈപോക്കിയാൽ ബോറടിന്ന് മാറ്റുന്ന രീതിയിൽ പോകാം. Okay, straight away I'm going to topic. See, I'm not going to take a class on Snehapana. As Doctor told, the definition of Snehapana, classifications, the modalities, lot of things are there in our Samhitas. And there is utter controversy among Charak, Vakpada, Susra, and all. Let it be there. I'm not at all interested into that theoretical part. How practically we are doing Snehapana and Kottakkal. Simply, I will share our experience. That's all. Nothing theoretical background, nothing about like this. That doesn't mean it is not theory. Practically, what we are doing, that I will share with you. Okay. So, what I'm planning is, whenever we go for discussions on Snehapana, even in the class also, in your PG class also, different questions we are getting, different challenges are coming, purely on the practical aspect. So what I'm planning to do is just I compiled the questions, FAQ, like frequently asked questions. I do have around 15 questions, 1 to 15. I will try to answer that questions. 5 minutes each, so 1.5 hours. Then 15 minutes we'll go for a discussion also. I planned in that way. More on questions you can ask. If I know it, I will try to answer. So first, let me answer my questions to you. Okay. So the first thing comes, to whom shall we do Snehapana? Where exactly the placement of Sneha? Or is this type of Acha Snehapana is needed, or is it practical in day-to-day practices, apart from the IP-oriented institutions? So my answer is, when we treat a patient, say whatever may be the diagnosis, Vadarakta or skin disease, psoriasis, whatever, we are following a treatment. We are starting with the Dipana Padana or Kashaya, Lahya, Rishta, some procedures and all. So that is the way, that journey of a doctor managing in a treatment. Some place we prescribe a Sneha, an internal Grida or internal Taila, we prescribe. Yeah, that is the time of, that is the indication of Snehana in that particular patient. So in that point of time, we decided to do Snehana. This is so simple. Theory is there. Behind there is a theory. I'm not going to the theory. So it's the freedom, the wisdom of a physician to prescribe Snehana, or in this particular patient, in this particular point of time, the treatment modality, the media is Snehana. Okay, that is the point of the time, the Samprapti, the Khadaga, the Avastha of doing Sneha. So that means that we decided to do Sneha. So the decision has come. Then how to do Snehana, which Sneha, how duration, a lot of things are coming. For that particular purpose, we go to our classics, our textbooks, Sneha Vidhi. In Charaga Panchagama Vidhi Vidhan is very beautifully narrated. Ashardi also, Sneha Vidhi is here. So that time we are going back to the Sneha. So then we have to follow the guidelines of Acharya. There must be somebody to instruct us. So the Samhitas, they are instructions. So my point is, when you go into the classics, there are different methods of doing Sneha. Among them, one is Vijarana Snehapana, a small dose with food or without food, or without making the restrictions of food we are giving. 50 milli 2 times, or 10 milli at bedtime, or even with Kashaya, or even with some other modalities. That is a commonly practiced Sneha procedure, I feel, in Kerala and across India also. I'm not talking about the Shodhana. So what I mean is, our major Sneha procedure is based on Vijarana Sneha. Achabana, we are not at all interested, not like that. Institution based it is there. But when we go through the classics, when Acharya compare the types of Snehana, he himself said the best way of doing Snehana is Achabana. It's not Vijarana. So the first choice come to Achabana. So this is what I want to tell you. Whenever we decide to give Snehana into a patient, think about Achavana only. Never go to Vijarana. All the formalities of the Achavana we have to go, because that is the best Snehana procedure according to all Acharyas. Okay, patient is there. Now we decide, is it how to do Achavana in this particular patient? See, he may be a stone patient, a renal stone is there. And he takes a lot of water in between. For that particular patient, when we impose the procedure of Snehapana, the rules and regulations of Snehapana, it's impossible. We can't do it. Like a diabetes patient, highly diabetic, with the under insulin control and all, he may not be able to undergo the strict restrictions of Snehapana. So what I mean is, there are some area where Achavana is not at all possible. It's not feasible. We can't move ahead with the Achavana. So in such conditions, we go for Vijarana. So that is the direction what Acharya is telling. If Achavana is not possible, then we can go for Vicharana. So what we believe, people who are coming to us, they are not fit to do Snehapana or Achavana. We consider that all people deserve Vicharana. So that is why Vicharana is so popular among our practice. This is a wrong thing. This is an unethical thing. If the patient deserves Achavana, we have to do Achavana. Otherwise, who will do? So we are the authorized practitioners. We have to give the best treatment to the patient. But ourselves, we are shrinking to ourselves depending on the feasibility from the part of the patient. We decide like that. So my humble request, whenever we advise Snehapana, always think about Achavana. Vicharana is second thing only. If Achavana is not possible, think about Vicharana. So my focus is based only on Achavana. Vicharana, I'm not. Time is there. We'll discuss later. Okay. So in Achavana, I will tell you an example. See, a patient coming with the CASA, dry cough is a chronic cough is there. Say we are giving Indugandha Grada or Bidariya Grada. In Vicharana, we give Indugandha Grada or any Grada 15 milli 2 times or bedtime. How many days shall we give the Grada? It may take weeks. It may take months. Even in skin disease also. We give Tiktaga for 1 month, 2 months, 3 months. Goes on like arthritis. We give Gululu Tiktaga 2 weeks, 3 weeks. Go on like this. Instead of that, our purpose is Shamana. Vicharana means we are doing Shamana. So instead of that type of Snehana, if we go into Achavana, means a high dose, then within few days, that time period can be reduced. Within few days, we get the results. So I have dry cough patient. Since 3 weeks, we are giving the Vidayarya Grada 15 milli bedtime. If that patient, instead of that 50 milli, if we give 100 milli or 50 milli or 75 milli, depending on the Agni, that is Achavana dose, Shamana dose. When you give that dose, it takes maximum 1 week or 2 weeks. Don't go beyond that. This is the true reality. So I request all the doctors come back to Achavana. Wherever possible, do Achavana only, not to Vicharana. Okay, so if that is the purpose, this is the total intention of this discussion. How to go ahead with the procedure. Okay. So the next question comes, how to prepare the patient before doing Snehapana. Once the patient got admitted today, we are not supposed to give Snehapana tomorrow morning, from tomorrow morning onwards. So we prepare a patient. This preparation is the most important in the efficacy of the Shodhana purpose, if we are discussing Shodhana. So patient is there is a patient, say psoriasis or arthritis, we are planning to Virejana or Vamana, whatever may be a Shodhana. So that particular process, if you are preparing Snehapana, one thing I will tell you, these diseases are residing in the deeper dhatus. We know Gambhira Madrakta, deeper and deeper, goes deeper and deeper. Kushta, all such Mahavadi and all, especially chronic diseases, the dosha resides in a deeper level. It may not be in the Kosha level, maybe in the Shakha level, maybe in the Madhyama Roga Marga. So Ajar is very clear. Our purpose is Shodhana, Vamana or Virejana. If the dosha residing in the deeper dhatu, not being brought into Kosha, there is no meaning in doing Shodhana. So at any cost, we have to bring the dosha into the Kosha. So for that purpose only, we are doing Snehana and Svedana. This is the Purva Karma. So if the Snehana is not proper, is not properly executed, then no question of dosha coming to the Kosha. What is required? Vriddhi, Abhishandanam, Pagam, all these things are required. Then only dosha will come to the Kosha. For these 3 stages, an excellent Snehana is needed. Snehanam, Sneha, Vishinda, Mardava, Kaladagara. It has to do all these things. So for an effective Snehapana, to achieve the extreme, perfect Samya Srinkhalaksana, that process must be very, very, very perfect in all aspects, in dose, in duration, selection of drug and all. So, for an optimum absorption of the ghee or the sneha, we need to prepare the patient in a proper way. So, Snehapana is a Purogarma for Vamana Virajana. Again, I'm telling, we have to do a Purogarma for Snehapana. This is very important, Purogarma of Snehapana. So, that Purogarma, how effectively we are doing the Purogarma, purely depend on that Purogarma, the Snehana procedure succeeds. Usually, our practice, what we are doing, we give some powder, Vaishwana Churna, Rashtra Churna, 3 days. Then the 4th day, we start the Snehapana or some Kashaya. So, what is the purpose of this Purvarma is making the patient, bringing the Agni into normal states, cleaning the channels of circulation. Then only the Grida will be properly digested, absorbed, and circulated. So, so this proportion is most important. I will tell you how we are preparing the patients. See, there are 4 options for it. 1, we can do any sorts of Dipana Pajana medicines for the patient. Dipana Pajana medicine, but no Grida preparations, no ghee preparations. You can give Kashaya, tablets, Arishta, Churna, whatever may be, based on the particular condition. That is one thing. This Acharya says Dipana Pajana and Dukshana. That is what I am telling, like this Dipana Pajana medicines or Shavana medicines you can give. 1. Second thing, we can put the patient in Upavasa. Upavasa doesn't mean a long, serious fasting. It is not like that. Depending on the condition of the patient, we can plan the Upavasa in different ways. Say very obese, diabetic, hypercholesteremia, everything is there. Then you can put the patient for 5 days or 7 days, strict Upavasa. Absolutely no problem. But the effect is, if a patient is Vada dominant, very lean, he is not in a position to undergo such Upavasa, you can reduce the food half, 50% reduce the food, or you skip the lunch, or you skip the dinner. In that way, Upavasa, what I mean is limiting the food intake. Then, third thing, Takra is a best option, buttermilk. So, flavored buttermilk, you remove the butter completely. Prepare the buttermilk, don't purchase it. Churn it, remove the butter completely. Then you can flavor it. And ask him to take the buttermilk whenever he feels thirst or hungry, water, only water. Like 3 liters or 4 liters, 5 liters of buttermilk they take. Then 4th option is procedure. Any procedure depending on the condition. Say in arthritis, we can go with the Dhanyamla Dhana. In neurological conditions, we can do Udvartana or Churna Pindasveta. Any sort of Dushna procedures we can do. So I doesn't mean all the procedure in one patient. Depending on the condition, diagnosis, you choose the procedure. Even if say an MND patients, lot of emaciation is, then also it's advisable to advise little bit of Upavasa, 1 day or 3 days. That helps the Snehana to absorb properly. Okay, this is the procedure. This is the Urvarma we can do. We have studies also on it. See, in I told you about buttermilk, Takramana. Our studies, our PGs, they have done a study on, I think it's 15 patient like this. Buttermilk 1 group, without buttermilk 1 group. The result was very excellent. Means a lot of results are, one thing I will tell you. Those patients consumed Snehana after taking buttermilk. The complications were very, 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 very little. Say, vomiting and diarrhea. 1.5% or 2%. That was the incidence of complications during Snehapana in patients who took buttermilk before Snehapana. Like the quantity of the large quantity of Grita they can consume if you prepare properly. Then with short duration, we get some missing Halakshana. Like lot of result outcomes are there. I'm not going to that details. It's not warm buttermilk. Buttermilk is our routine buttermilk. Prepare in home. Don't purchase from the shops. That makes loose motion. We do have a lot of experience in that condition. Okay. So then how long how long shall we go with this Langhana or preparation? I told you earlier, our practice is just 3 days, 4 days, 5 days. It's not like that. See, we do have an intention why we are giving this preparation. To make Agni, to make Rukshada in the body. Only in Rukshada, Snigdha will be absorbed quickly. So observe the patient whether Rukshada is increasing or not increasing. Till Rukshada, till getting Samik Ruksha Lashna, continue this preparation. It may take 5 days or 7 days. Rukshada, there is no specific recommendation of Rukshada. What is our experience is patients start constipation. After 2-3 days, constipation develops. All sorts of other pitta conditions aggravates. In psoriasis, exfoliation, profuse amount of skin will peel off in psoriasis. In pain conditions, arthritis and pain will aggravate widely. Then definitely scandy mixation will come. Dryness in the face, dryness in the mouth, lot of such things. Even the sleep will also come. So while scratching the skin, we get the Rukshada. If you are sure that patient achieved Rukshada, stop it and start with the Snehapana. Okay, this is the preparation of a patient. Then the second question comes. So we prepared the patient. Okay. Then conception, how to drink the Snehapana. In drinking Snehapana, drinking the Grida, we do have a very good recommendation, Acharya. Close the nose with some smelling things, close the eyes, a lot of things are there. So what is asking, could you tell some tips for easy consumption of the Grida? That is the question comes, sir. So a few questions I will tell you. Aversion is a problem in Snehapana. Even I can't take giving. Not I am not asking to give Anna, but our paya means that liquid part only. Kanji vellam, diluted kanji vellam, thin gruel. Okay, very little. 1 spoon, 2 spoon in that we only give. Don't give otherwise. Then another question comes about Udgara Shuddhi. Usually problem comes, patient says appetite, give little water. Again, there is no smell and all. So Udgara Shuddhi is there. Usually we give food. We give the paya. So while taking the paya, again the Udgara is coming, smell is coming. This is a practical problem. Because what I'm telling is, say, to get a smell, to get the smell, suppose say minimum 25 milli Grida is needed to produce the smell. Believe like that is not theoretical, is not mathematics, not like that. Believe that if 25 milli Grida is remaining in the body, then we get a smell. Okay, so minimum required quantity is 25 milli. What about 24? 24 milli is there. So we get Udgara Shuddhi because 25 is Udgara Shuddhi. So only on observation of the Udgara Shuddhi, little water, never give food. Wait half an hour wait. Then anything remaining, any Grida is there, let it be also get digested and absorbed. Then we get a proper Udgara Shuddhi and go with the food. Then another question, after consuming Snehana, is it needed to lay down by covering a sheet? That practice is also there. No, absolute bed rest is essential. That must be advised, absolute bed rest. No need to cover with a sheet and all. That doesn't matter. If they take, okay. But my point is, all the complications like loose motion or nausea or vomiting, all are directly related with the motility of GAT. So if you take absolute bed rest, such complications can be avoided. So ask them to take absolute bed rest. Be in the bed. Don't move here and out. Don't sit in other bed. So that is fine. So bed rest is needed. These all are some tips in the procedure. Okay. Then another question comes: what is the dose of Snehapana? So I have seen in many procedures, many states, they plan Snehapana for 7 days. Today start with the 50 milli. Then the chart will be ready in the case sheet: 50, 75, 100, 125, 150, 175. A fixed increase of 25 milli, maybe 30 milli or 50 milli. So it's a pre-planned, well-determined Snehapana procedure. There only the question of dose comes. So this way of practice is absolutely a nonsense. Never fix the Sneha dose previously. No prior determinants. Tomorrow morning, the dose has to be decided tomorrow morning. If it is not feasible today night, today evening, never fix the dose of day tomorrow, day after tomorrow, or after 2 days. So purely based on the assessment on Costa, assessment on Agni, what has happened today. Today morning they have taken and the entire day what happened. Accordingly, fix the dose for tomorrow. That is the way we fix the dose. And another thing, all Acharya same, they are opining the dose regarding the dose. They calculate the dose in terms of time of digestion. 6 hours, 12 hours. Vagbada is telling for Shodhana, 24 hours is needed. Oh, any dose, any milli of the Grida or oil, that must digest within 24 hours. That Vagbada says. Whereas Charaga says it's 12 hours for Shodhana. So what I'm telling is dose is based on the time taken for proper digestion of the previous dose. Okay, so accordingly, in that case also, I told there is controversy, difference of opinion about Acharya. In the case of usually in practice, there are only two types of general practice. One is for which the Grida digests within 6 hours. One is Grida which digests within 12 hours. For the day-to-day practice, I am telling. Vagbada is telling 24 hours Shodhana, Charaga is telling 12 hours for. In this particular situation, I wish to go with the Charaga only. That is a feasible thing, that is a practical thing, that is what we are doing in Kerala. So dose means any quantity of Grida, any quantity of the medicine which digests within 12 hours. That is for Shamana Shodhana purpose. And for Shamana purpose, any quantity of Grida oil digest within 6 hours. So 6 hours and 12 hours. We make a plus or minus 2 hours. So 10 to 14 hours. Keep a range like 10 to 14 hours for Shodhana. Then 4 to 8 hours for Shamana. Okay. Once I clear you. Morning, if you take the Grida by 6 a.m., it has to digest by 12 a.m. or 1 p.m. That is Shamana type of dose. When you take the Grida in the morning 6 a.m., if it digests properly by 6 p.m., 12 hours, that is Shodhana. 6 p.m. means maybe 4 p.m. or 5 p.m. or 7 p.m. or 8 p.m. plus or minus 2. So that is the dose. So don't measure the dose. Dose calculate at the rate of time consumed for digestion. Okay. Then about the guidelines of Arohana and Avarohana. How we plan the Arohana Krama, how we plan the Avarohana Krama. See, classics, they are not talking about Arohana and Avarohana. Of course, in the later on versions and commentaries, there are some mention about Arohana and Avarohana. But in practice, practically, when do Snehapana, this Arohana will come. That's an inherent part of Snehapana. Because the dose purely depends on the Agni. And Sneha is the best media to promote Agni. Sneha meva paramanala deepanam. So by the procedure, actually we are enhancing the Agni. So whatever the dose we scheduled, we started the first day, will never remain same in the second day, third day, fourth day. So we will be forced to increase the dose because our target is 12 hours or our target is 6 hours. So we will increase the dose. So knowingly or unknowingly, we are going for an Arohana Krama. This is what the classics, what Acharya intended to do. If we fix the Arohana Krama, 50, 75, 125, then back to 100, 75, 50. What is that Snehana? Is it Shamana or Shodhana? We do have an ultimate aim. Make Ulklesha, make Shamana. So it's a pre-planned increase and decrease. Such type of Snehana, I don't believe, I never do it also. But Arohana we do. That is by practice, it is coming. It is not determined, it is not advised based on that thing. So that's all Arohana and Avarohana. Then how many days? How many days shall we continue the Snehapana? See, we do have a thumb rule, 7 days. There is no thumb rule like that. What is the purpose of Snehapana? Patient is coming with the pain in the knee joint. If our purpose is to reduce the knee joint, time period is till the pain reduces. There is no 7 days or 8 days. If it reduces with the 5 days, why can't we stop it? So symptoms must subside in the Shamana type of Snehapana. It may take 3 months, may take 1 month, may take 3 weeks, depends. So in Shamana type of Snehapana, the duration is subsidence of the signs and symptoms. What was the purpose? If the purpose is achieved, stop it. Don't count days. If it is Shodhana, again is different. In Shodhana, there is a direction from the Acharya. See, in Krura Kosha, Acharya says, do it 7 days. In Mrdu Kosha, he says is for 3 days. Yeah, that is true. That is absolutely true. So a patient coming with the Krura Kosha, our decision is 3 days. We do decision 3 days Snehapana. What is the first day dose? Is it 50, 75, 100? Who will tell? No, it is not planned. We don't know the patient previously also. It is a new patient. So there is a advice. What Acharya is telling, you give a little dose, a Hersvesima, just to test his Agni. Okay, 25 ml give, observe. Okay, 25 milli morning 6 a.m. Morning we give 25 milli, observe what is the time required for digestion. Say it's 11 p.m. I mean 11 a.m. or 12. Am I sure to fix the dose? I'm a little bit confused, but I know a little about his acne. If you take 25, minimum 3 hours is required or 2 hours is required. So a little bit confused. So solve the confusion by giving one more dose. So today 25, tomorrow you give 50 or 75 give. Then observe how much time it required for that digestion. So after second day, we may conclude, yeah, for this particular patient, in this particular condition, in this particular Pura Kosha, his 12-hour duration, the quantity of Grida required to be digested within 12 hours is 100 milli or 150 milli or 200 milli. We can make an assessment like that. So that is the dose for that particular patient. So what about the first day and second day? If you are not counting the first day and second day, okay. The third day onwards, you count 1, 2, 3, that's enough. If you are counting the first day and second day, then it is 3 plus 2, 5 days. Okay, it comes like that. So you start with the Snehamritra Hrsvasi Matra, then a Hrsva Matra, then fix the dose. And from that actual dose, you start the Snehapana. Meantime, one thing I will tell, difference with Shamana and Shodhana. See, 25 milligram first day we consume. Say in the third day or fourth day, say it is 200 milli or 250 or 150. A large quantity is there. So once a large quantity, one day it is 25, other day is 200 milli. Just think what is the fate of that snehana, what happened to the snehana in the body. The 25 milli small dot that might have been metabolized properly, absorbed, circulated, and stored as energy. That become part and parcel of our body. We call it as Satmyada. Sneha became Satmya. Whereas the other thing, 200 large dose, that will never become Satmya to our body. So this is the basic difference classification Snehana. One is for making Satmya, other one is for making Asatmya. If the intention, the purpose of Snehapana is Ulklesha or it's a Shodhanartha Snehapana, definitely the Sneha will turn as an Asatmya material in the body. That will never be got digested, absorbed, and stored as energy in the body. It should remain as a foreign body in the body. Acharya is very clear. Alam malan ireidum snehasya asadmyadangada. If it become asadmya, then only that Krida will make Ulklesha into dosha and pave way for taking them into the Koshna. So asadmya type of Snehapana. Whereas sadmya is not like that. Sadmya will be absorbed, like what dosha Italy we had. Now it is become sadmya, same way. So in the 7 days or 5 days Snehapana, what the first day 25 milli, that became sadmya. And the large dog, the same, became asadmya. So Ajarya is 7 days for Krura Kosha. That 7 days, the Sneha will become asadmya. It will remain as a foreign body, as an asadmya material in the body. Then no Klesha is possible. So first day and second day never comes in the picture. That became sadmya. So delete that days. Count the actual day from the third day. So 7 plus 2, 9 days. So there is no thumb rule like rule of 7. It is not like that. Till Sammik Snigdha Lashna achieve. Say, suppose in the 8th day we get some or in the 10th day we get some knowing it or unknowingly. 10th day we got a good sammislashna. Am I wrong or not? No, that is true. So don't count on days, but focus on the symptoms what the Sneha produces. So that is the duration. So in Krura Kosha, we can go up to 9 days, 7 plus 2. Mridu Kosha, 3 plus 2, 5 days. In Susula, they are giving permission for 11 days. So there is no meaning in depending on the number of days. Okay. Then how to stop Snehapana? When to stop Snehapana? See, our practice is like that. Think ourselves in our practice during our Snehapana procedure when we stop. Some people stop Snehapana when the patient omits. Some people stop Snehapana when there is a loose motion, diarrhea, or both are. Some doctors stop Snehapana on the 7th day, 7 days. 7 days. Very little people, very less people focus on the Sammisnigdha Lashna. So what is required? We need Sammisnigdha Lashna only. See, omitting or Shardi, nausea, not a Sammisnigdha. Snehoddesha is there, that is not omitting, that is not nausea. Snehoddesha is different. Other style Snehodarsana is there, or Asamhada Varchas is told. That is not loose motion. That is not Sammisnigdha Lashna. Loose motion is not a Sammisnigdha Lashna. So don't stop Snehapana based on this Shardi, loose motion, then such things. Focus on Sammisnigdha. Only after obtaining Sammisnigdha, stop Snehapana. Otherwise, the entire effort will be in vain. There is no use in doing Snehapana if the Sammisnigdha are not obtained. Okay, coming to Sammisnigdha Lashna, the famous quotation we know, Vadhanalomyam, Diptokni, it goes on like this. The Vadhanalomya, it's a Sammisnigdha Lashna, true. Let me ask you, around 300 doctors are here. How many of you stopped Snehapana after observing Vadhanalomya? What is your answer? No. Am I true? None of us have stopped Snehapana by observing Vadhanalomya. Again, Diptokni. How many of you stopped Snehapana observing Diptokni? None of us. Then what is the fun in keeping these things in Sammisnigdha Lashna? Making problem in Vaiva, Panchakarma Vaiva. So let me make a statement very clearly. The signs and symptoms as told in Charaka, Susruta and Vakpada is for Swastha people, not for patients. You may not be agreeing, but think 10 times, then you agree with me. The symptoms, Vadhanalomyam, Diktagni, Varchasnigdham, Asamhadam, Snehodega, everything. This is not for patients. This is for Swastha. If it is for Swastha, then what is there for patient? Ajarya is not, he is keeping silence. It is not there. So it is our responsibility. It's our responsibility to develop Sammisnigdha Lashna based on the conditions. So case to case, the Sammisnigdha Lashna has to be developed. It is there. Psoriasis, they are developed. Arthritis is developed. Some skin disease also. It is going on. It's coming process. Why I said so? Coming back, see, two things. One is Angalakhava, other one is Klama. Sangraha is telling Angalakhava is a Samyak Lashna, Klama is a Samyak Lashna. Like lot of things are there. Just I am telling one example. If I am experiencing Angalakhava, Lakhava means Laghutta. Angalakhava is there. I'm free. There is no head, no heaviness, nothing. I'm free. Vada in the normal stage, that is Angalakhava. When I experience Angalakhava, can I experience Klama at the same time? Tell me, is it possible or not? Or a patient experiencing Klama, Anayasa Srama is Klama, no? He won't be able to move ahead. He wants to lay down only, totally exhausted, even not in a position to sit down or stand up. That is Klama. Such patient, Angalakhava is there. How is possible? Not possible. So, a set of symptoms told by our Acharya is a collective for Shamana, Shodhana, and Brahmana. So, Angalakhava is there in Snehapana. That is for Shamana only. Klama is there in Snehapana. That is for Shodhana. So, it is our responsibility to classify the signs and symptoms into two groups. These set of symptoms for Shamana, this set of symptoms for Shodhana. Accordingly, there is a work at Kottakkal. I think Dr. Indias, he has done a work. I will come to the conclusion only. What he has done now, around 40-45 types of signs and symptoms are there if you combine all the classes told as a misinformation. Out of the 42, what he has done, he come to 3 only. That is Klamam, then Adhasal Snehadarsana, Asamhada Varchas. Got it? Klama. Klama is mandatory. Without Klama, we can never stop Snehapana. Again, one additional point is Klama is there. During Snehapana, we get Klama in different situations. Say, if the Grida go for indigestion, say Ama is developing, patient is going for a fever, Klama is there. Or after consuming the Grida, after some time, 1 or 2 hours, that is a time of Jirimana. Jirimana Lakshana are told. There Klama is there. Then Samya Snigdha Lakshana, Klama is there. So a lot of different types of Klama is coming. So which Klama correspond to Samya Snigdha Lakshana? That is important. So the very simple, patient says Klama, or we can appreciate Klama in that patient. You give the kanyi, give the food. After consuming the food, the Klama exists. That is the Klama specifically mentioned for Samya Snigdha Lakshana. So Klama should not subside after taking food. That is Samya Snigdha Lakshana, Janya Klama. Jirimana Lakshana Klama is there. By 10:30-11, Klama will develop. By 1:30-2:30, that will subside. That will go as such. That is Jirimana Klama. Other one is Ama. Ama will leads to Jara and all, we won't be able to continue the same. So Klama is the most important thing. Then Asamhada Varchas. I'm not talking about Snigdha Varchas. Snigdha Varchas we get from the very first day. But Asamhada Varchas is different. Varchas gets its solid form only because of the Vada dominance. Pindidam Kadumaridi, Dukshaguna, Kaduguna of Vada, that gives to the semi-solid nature of these roots. In Snehapana, what happens? I am Snehamayo, every Srotas became Snigdha. All body became Snigdha only. So in such a situation, Ado Shadrasobyanam, Madri Bodham Erit, Beni Bodham Kafam Yadam, we know that evolution. So in third stage only, this Pindidam Kadu Marada is coming. So Vada dominance is coming. Only because of the Vada dominance, the Pindaruba is coming. Now in this particular day, at the final stage of Snehapana day, Vada is not at all dominant in our. So it skips to the Pitta dominance. In Pitta stage only, we get the Ulklishtamala. Ulklishtamala is coming. So there is no question of. So what I'm telling is the Asamhada Varcha is happening at a high level of metabolism, not simply mixing the Grida. So this theory forget. Asambhada Varchas must be there, Klama must be there. And the third one, Adhastal Snehadarsana. Susra is telling, Sangraha is also telling. Adhastal Snehadarsana. In undergarments, patches will come, Sneha is coming. Bas, that is enough. It's very simple. You forget everything just based on 3 symptoms. If these 3 are there, you are very well, you can stop the Snehapana. Klama occurred, definitely. Okay. Other things, Deepta Agni and Lakhva. Vadanilomim, Deepta Agni. These 2 things are essential. They are essential to maintain the Snehapana, to monitor the Snehapana. Tomorrow to increase or decrease the dose. Based on Agni only. Shall we continue tomorrow? Based on Agni only. So Agni is needed. Agni is needed. It's a good monitoring factor in Snehapana. Okay. So this is Amish Nidalashna. It's my humble request. Never stop Snehapana based on other things. Purely based on these 3 things. I'm not bothering you with the lot 42 symptoms. Leave it. Just 3. Is it possible? No? It is possible. You stop only based on these 3 things. Again, these 3 things will come in Swastha only. If I take Snehapana, if you take Snehapana, no symptoms at all, you will end up with Klama. Klama is basically because of a lack in carbohydrates. If feed the patient, go on with fat, that will go for Klama. Our brain says so. So Klama is invariably to produce a Klama, Kushta is not needed. To produce Klama, arthritis is not needed. To produce Klama, any other disease is not needed. Swastha can make a Klama. So this is one thing. These 3 things are general symptoms. Plus, what else? Plus the particular condition, the presentation, the clinical situation. What happened to the clinical situation of the patient? This is the most relevant thing. See, for example, I'll tell you in psoriasis, this work was done on psoriasis. In psoriasis, as the days progress like this, 1 day, second, third, or fourth day, exfoliation will come. All the scales will come out. Then a very bright area we observe, patch we observe there. If you touch with a tissue paper, it becomes wet. So exfoliation, then wetness of the area surface. Then later on, it starts oozing down. Then the condition worsens. In psoriasis, few spots were there, here and there was a few spots. After this, Snehapana spreads everything. Patient complained like that. In back, there was 2-3 spots. Now, after this Snehapana, the entire back is covered with. So the area extends. The condition aggravates. Blisters are coming. Cracks are coming. Size increases. These all are the things happening in psoriasis. In Vijarchia, that Sagandu Pidagashava Lesigantia Vijarchia, already Lesigantia is there. So profuse Lesiga is coming. Kandu is increasing. Blackness is increasing. All symptoms aggravates. Since some Dedru-like symptoms, suppose there, you do Snehapana, no? In the 4th day, 5th day, or if sammisinhalation is there, what I'm talking is only in sammisinhalation, otherwise it won't get. If you prepared it properly with the takra, then only you achieve this stage. Some patients I observed, when we put shampoo, while bathing, put shampoo, entire head is with the froth is coming. Just like so many patients came to me. In the 3rd or 4th day Snehapana. That is the extra oozing of this, what do you call the dosha inside? Prasigantia, oozing out. So all such symptoms will aggravate in Snehapana, especially in Kapha Pitta symptoms will aggravate. Then only we can assume that, yes, the Snehapana is going the right way. It is making Ulklesa in the body. Not simply digestion going out, it is making Ulklesa. So the symptoms must aggravate. Okay. Meantime, what I'll tell you, when this much of exfoliation oozing is coming, in the management, you don't wash it with the trifle and don't give any gulgulu tikta or don't give any kashara yoga gulgulu and all. That's not required. This is a doctor-made issue, iatrogenic. We only made. Our procedure is the cause of this thing. So it's a Paga process. Previously there was nothing. It converted previously it's a dry Pidaga was there, now it started oozing. That's a Paga process. It's a change. Na Paga Pitta. So it's a real culprit is Pitta dominance. So you go do a Virajana, a strong Virajana with the Abhibhati. These things will subside. Virajana means not, it's a Sadhya Virajana, not the other Virajana, Sadhya Virajana, just for passive. Okay, I mean that only. So this is the way. So the general symptoms 3 plus the specific symptoms of the disease should increase. That is perfect submissive relation. Okay. In psoriasis, if pain is there, that will subside only, that will never increase. Means Vata Kapha symptoms will aggravate, Kapha symptoms and Pitta symptoms will aggravate, Vata symptoms will subside, Rushada will come down, pain will come down. In psoriatic arthritis, that pain of the joint pain will come down, but other symptoms will aggravate. In Shwasa, lot of congestion will increase, Kapha will increase. One day, the patient omit it out also. So, Vijay, I told you, likewise, specific, disease specific, symptom specific, Samya Lakshana has to be developed. Such works are going on. I'm happy about it. So that will come later. So this is a responsibility of the doctors. Okay, so that about Samya Lakshana, a proper observation. It's my humble request. None of us are interested in Samya Lakshana. Please observe these 3 things plus the symptoms of the disease. Okay, so that is about Samya Lakshana. Then about the drug of choice. 11:30. I'll finish. Drug of choice. I don't know what to say. In Tiktaga is good in Kushta. Dhanadara is good in Prameha. I'm not going to that thing because all of us know the indications are not. But little deviate. I will tell you another thing. See, another question. When this topic came, some doctors asked me, you will be talking about giving pure ghee and all. True. So I'm very clear in this thing. You do Snehapana with the plain grida or medicated grida. In a Kushta patient, do Snehapana as Tikta grida. Do Snehapana as pure grida, pure ghee. Absolutely no problem, we will get Sammislashna. Because both are Snigdha, both are Sneha. Samskaras Anvartana is there, but doesn't mean Snehana or Snigdha Bhava is there. We get Sammislashna, absolutely no problem at all. In plain ghee also same thing will happen. So think about other factors. If you're doing Snehapana with the Tiktaga Grida, the chances of failure is very high. Very difficult to consume the Tiktaga Grida. Whereas plain Grida, large quantity of Grida we can consume. It's very tasty also. So a lot of factors are like this. It's up to you. You decide what to give or not. Studies are there. In studies, it's reported. It's a comparative study. 56 patients. Those who consumed plain Grida, they consumed a large quantity when compared to Tikta Grida. Some escalation in the 4th day or 5th day they observed, whereas in Tikta Grida it was in 7th day or 8th day or 9th day. So quantity increases, duration decreases. The most important thing is complications. In Tikta Grida, 17% of the patients omitted 3rd or 4th day. Then it's very difficult to continue Snehapana. Total aversion has come. 22% of patients had loose motion. It's not feasible to continue the procedure. Whereas in the plain Grida group, it's 2.6, 1.8, that is the percentage. So the complications are minimal. So for a success in Snehapana, success by all means, to achieve a Sammisradrishna, as I told you earlier, if that is intention, comparatively, plain Grida is good. And this plain Grida is only for a short period. It says 7 days or 5 days. Then we are doing the Vamana or Virajana. Then for Shamana, we have to use the same Tikta Grida. Then why we are showing an aversion to plain Grida, I don't know. Some people say in plain Grida, when we add a medicine, that medicine part is there. So that medicine will bring the Grida to that corresponding site. Etra Sangha, it reaches there. So that is the role of the medicine they are talking. I don't know. If I take 1 teaspoon pure ghee, how can we say that Grida is going only to the legs, only to the eyes, only to the head? It's not like that. What they are telling, he puts a piece of Brahmi or Manasiga, that medicine, then it reaches the brain. In psychiatry, we do have psychiatry there, no? That's certainly. In psychiatry, added with the Shankhupushpa, Brahmi, or any medicine recommended, then that will reach the brain and that will work perfectly. That is the argument coming. There is no meaning in that argument. Where anything you consume, there is a routine metabolism that will reach entire body. Even plain girda, what is the property thing? Shastam, Dhi, Dhridi, Smriti, Medha, everything is told in plain girda. So girda will do it. No need of a medicine at all. So it's very cheap and very delicious also plain ghee. So always I prefer plain ghee for ulklesha, only for ulklesha purpose. I'm not compelling you, it depends on you. So in plain, what Sammislasha I told you, that I observed only in plain girda. Other girda is very difficult. Gulgulu Tikta girda. How many days Nehan will go? Kalyana girda. How many days Sugumara girda? Patient will end up in diarrhea. It's Brahmi girda. Brahmi is a pure poison. Karaskara girda. Karaskara, one crushed seal is the lethal dose of Karaskara. In Vadarakta we are using, So 7 days Sneha with the Karaskara girda. What is the quantity of strychnine we are consuming? Is it Snehapana or Vishapana? That is the question comes. So unnecessary, in the era, there is a scarcity of raw materials are there. So just for 5 days or 7 days, go with the plain. Okay, then Shamana. For the Shamana purpose, only prepared medicines. That is the ideal thing. Then one thing I miss in between, the time of administration. That was to come up here. Shamana and Shodhana. For Shamana purpose, the time is morning. Don't say in the morning. Usually what we practice, we ask the patient what is your routine breakfast time. So usually they take breakfast by 7:30 or 8:30. Okay, so tomorrow onwards you take the Snehana instead of that breakfast. So what does it mean? There must be good acne, good appetite. That is the time for Shamana type of Snehana. Whereas in Shodhana type, that acne is not required. What has taken yesterday, that might be properly digested. There's no agni at all. Hestane, jirneva. Shamana, it is annakale. Very categorically, he's telling annakale. It is a type of anna. So that is for proper digestion. So if you take at 8 a.m., 8 plus 6 hours, I told you, 6 hours. So 2 p.m. So at the time of breakfast, you take this grida, let it digest by noon, lunch, 1:32. Then you take your lunch. Or in the night, if you are working, you need no need to take a leave for Shamana type of Sneha. Lunch, dinner you make by 6:30 or 7. Then by 9:30, take 50 or 100 milli, sleep. So it's a type of Achavana, Shamana type of. So that is a time I told you. Then again coming to drug of choice, I told you I'm not going to indication. Indaganda Garda is good for fever. It's I'm not going to that thing. Some other things I'll tell you. Some experience. Say, for example, ulcers, peptic ulcer, gastric ulcer, and all. We have a lot of studies. I'll just focus on the studies. Usually, a patient coming with the Parinamashula, gastric ulcer or duodenal ulcer. What is our practice? We give Tiktagarda, we give Kalyanagarda, Induganda, a lot of Dadimadi we give. But when coming to research, we don't have a freedom to give all the medicines. Either effect of Induganda in Paranamashila, effect of Tiktagarda in Paranamashila. That was the work done so far. Lot of work. CCRS has done a lot of work. But in this study, what happened? No? This is done by Dr. Ansi. She's from Vadagara. Before that, Vadagara, that place. What we have done, no? 3 Grida we selected. Indugandha Grida, Tikta Grida, Mahakalyana Grida. 3 Grida preparations. And given to Ansi. And told her, patient is coming. This particular patient needs what? The wisdom of the physician as well as the medical requirement of the patient. Both should meet properly. So patient coming with the ulcer is there. Perinamshal is common. Pain, food, that all we know. No? Along with that, pain, abdominal pain, plus, see, belching is there. Platters is there. Some bad smell is coming. So a Perinamashula patient presenting with belching, bad smell, platters, everything. Our assumption, our diagnosis is Parinamashula, but in the Ama stage. Avivakkum, Asamyuktam, Durgandham, Bahavichalam, Sadanam Sarvagatranam, Ama Ityavidede. So it's Ama stage. So that condition, can we give this Neha Tikta? Can give Kalyana Girda? No. So she prescribed Indugandha Girda. Now before that, some powder was given, I think Ashwagandha something was given for the preparation. So based on these symptoms, she started Snehapana with Indugandha Girda. Okay. We know Indugandha is Panchavala is there, Avakshara is there, Vata Kapha is there, lot of things. So Indugandha in Kapha dominance, Vata Kapha dominance Indugandha. After a few days, say 5 days, 6 days, gradually appetite developed, platters reduced, then that belching reduced, bad smell reduced. Means Ama stage is over, but pain is there. Pranamashula pain is there. So she shift to Tikta Grida. Snehapana is continuing with a new drug, Tikta Grida. That is for Ravana. So if there is an ulcer, it's a Dushtavrana. Pus is there. You wash, clean, rinse with the Trifala or Dettol, whatever maybe. Then we are putting Ravana exactly in the same way. When the patient developed pain only, all other symptoms subsided, she continued Snehapana with the Tikta Grida. See, after some days, 5 or 6 days, I mean, 1 week, definitely minimum 1 week is 1 week, 2 week, pain subside. After 15 days totally, 15 days or 20 days, pain totally subsided. Then also Snehapana not stopped. She stopped Tikta Grida, continued with the Mahakalyana Grida. Because we know it's a psychosomatic disease, no? The somatic part is still there. The psychic part is still there. Somatic part also might have healed. So the pacify the psychic part continued Snehapana with the Kalyana Grida. So almost it was total duration was 1 month. Anyway, invariably more than 20 days patients took this medicine. So this is the way of Snehapana. So indication what I am telling. My point is during Snehapana, it is not at all mandatory to continue the same medicine, same Grida the entire period. It is our freedom to change the medicine based on the signs and symptoms after keen observation of the patient. We get wonderful. In this study, there was a comparison group. There is an Alma hospital, it's a modern hospital. In that group, excellent result was there within 2 weeks. Almost all patients cured. Patients are very happy. But in our group, 2 weeks a little bit subsided, but compared to allopathy modern medicine group, our result was very poor. Then after 1 month or 23 weeks, after 3 weeks, our group also excellent result. Complete patients are happy, we are also happy. Only thing delay was there. Then rest is important. In modern medicine group, all patients got cured within 2 weeks. Most of them, except 1 or 2, came back for a follow-up. The recurrence of pain is there. Pain developed. Whereas in Ayurveda treatment group, after 1 year, 1.5 years, till her final exam, she was continuing doing the follow-up. After 1.5 years also, 1 or 2 patients came back. No recurrence at all. Statistically, there is no recurrence at all. So, result a little late, but a long-standing result is there. After coming, they are telling, no, after your ghee, pain has gone, nothing has taken. When the patient is coming with a new patient, then only we realize that that has been cured. So wonderful result is there. So it's my request to all the doctors, never continue Snehapana with the same medicine. Change. Always change. In Shamana and Doli, always change. Based on a simple symptom in the patient, simple change in the patient, change the medicine. We do have the freedom. So this is about arthritis. I will tell you few examples also. 11:40. I'll quickly finish. Few examples I will tell you. Arthritis. See, in arthritis, we treating a lot of rheumatoid arthritis patients. Pain is there, swelling is there. All the symptoms are not going to that thing. So we start Snehapana with what? Usually we do Gulgulita, we take, then we take Ishtimadu, we take Tiktaga, Mahatikta, a lot of. So observe the patient keenly. Vadarekta, Kapha dominance. Pain is that much pain is there, only stymith is there. Manda Charuk. Severe swelling is there. Constipation is there. All over body there is a swelling. So in such patients, Snehapana, this is end stage I'm telling. All other treatments over. Niru, Hastana, everything is over. The Shamana Snehapana. Start Snehapana with the castor oil. This is ideal. Then don't put her in Gulgulu Tikta. Gulgulu fine, okay, but not this stage. Start Snehapana with the castor oil. Very small dose, 5 milli, 10 milli, 20 milli, like gradually increase. There won't be any loose motion, nothing. This is Shamana type of Snehapana, Sadhana type of Snehapana. Gradually swelling will subside. 1 or 2 days, 1 or 2 weeks, the pain will subside. Then little bit of, the swelling will subside. And remaining little bit of pain, little bit of swelling or maybe there. That time, when it focused joints, Pradhamati Prabalan Samiran Sandhi Asti Majjagadam appear. That time, change the castor oil into Gulgulu Tikta Grada. Best Grada, Gulgulu Tikta. Continuous name of Gulgulu Tikta Grada. After some time, pain in hands and all okay. All small joints pain subsided. After 1 or 2 weeks, now the pain is located in knee joint. Everywhere okay, but knee joint still pain is there. So you stop Gulgulu Tikta Grada. Continue Snehapana Karas Karagrada. Kalin Muttadi Maria Marut Shonidam Nashame. Change to Karas Karagrada. That is the ideal thing. So this way of exercise we have to do in Snehapana. Lot of examples are there now, not going to all these things, time is over. In Shirishula also, we are looking Vada Kapha Shirishula. Heaviness is the pain is there, plus heaviness is there, exposure to cold that makes the pain and on. There also don't start with the Indugadagrada or Tiktagrada. Start with Varnadigrada. Start with Varnadigrada, let the Kapha and all come down. Heaviness and the Kapha down symptoms subsides. Then continue with the Mahatikta Grada or Induganda Grada, whichever Grada you want. In Vadarekta, I told again, in between, Dadimadi is also indicated. If the HV is coming down, patient feels pale and all that condition. Lot of, I'm not going to that details. Say other back pain. In back pain, what type of Grada we are giving? Instead of that, if the patient is having a non-specific low back pain, constipation is associated, start Snehapana with the castor oil only. And there was the castor oil, Shamana type of. Dr. Mahesh is an Ayurveda. He has done the study. Excellent result is there. It can be done in the OP level also. No need of taking leaves. He has given, I think, 70 milli in the treatment group at a time. 70 milli. Once or twice bowel. Absolutely no problem. Very gradually we have to increase the bowel. So these all are the things, the indications of drugs. Okay. One more point I will stop like this. Ask about the complications Snehapana. See, there is no much complication in Snehapana. The disturbing problems, one is nausea, vomiting, other one is loose motion. Commonly affecting problem, this is all the thing. Vomiting is not a submission, I told you earlier. In vomiting, it's an aversion only. No need of giving any Villuadi Lehi or Villuadi Gulya. It is not Shardi. No need to go Shaldi Jitsa. So take all preventive measures. You observe the patient. Vomiting is it immediately after consuming the Ghrida or after 1 hour. If it is immediately after consuming Ghrida, this is Dishta Shardi. There, what I told you, away from the patient, arrange everything and give him. That measures. If it is after few hours, that Shardi is different. That is directly related with Agni. There, you reduce the dose for tomorrow. Any type of Dipana Pajana Vadi, anything you can give like that. No need of a lot of medicines. In loose motion also, first day there will be constipation. Don't worry. That is also Snehapana end up like this. Second day or the third day, loose motion starts. In loose motion also, don't give Kudaja type of medicines. Kudaja Arisha, Kudaja Vilehan. This is not very original. We all are having a habit of carbohydrate food. Now we all of a sudden switched over to fat metabolism. So body will take some time to accommodate. That's all. So simple, little loose motion. Okay, don't worry. Reduce the dose or maintain dose and continue. No need of any medicine. Severe loose motion, severe vomiting, I stop. Okay. Then other problem is development of Agni-mandya and Jura. So it's a common thing. Morning 6 a.m. we took the medicine. By 4 p.m., 5 p.m. or even afternoon, feel slight temperature. Belching is coming. Totally tired, lethargy. It is not clama. Classical ama is developing. You ask the patient. Again ask, second, third examination. Then he will tell little bit of food. He has taken a biscuit, some visitors came, so took a biscuit, one bread, something like that. So that food makes the problem. Definitely, if Agni is not digested, I mean, Agni is not there, don't take food. That is our routine, our practice. In between, if they take food, that goes to that end up with Ajirna, Ama, Ajirna, and Jura. So in such conditions, Sadhyo Bhukteva Sanjade Jure. Very simply, what we can do, this Grida is there inside. That makes the problem. So give any tablet, what is available. मान लीजिए Kaishwaraglu Yogaraj, what is available in the bond, ask him to chew like this. When he chew a tablet, definitely vomiting will come. Then that he will go out. So that is the treatment of Jara. Sadhya Bhukteva Sanjade Jara. So once the Grida has gone, next day give a rest, then you can continue. If it is related to the food. Then lot of other complications. If it is Madhushyadi, patient will come, complaints coming, blood is vomiting. That is not blood, it is Madhushyadi. Gululatikta urticaria is there. At the Bhaladaga sensitivity. Then scanty urine, burning micturition, a lot of things. Scleritis, gastritis, early menstruation, fatigue, pain abdomen, a lot of things. Early menstruation is a common thing. Periods will start earlier. That's it. Nothing to worry. No medicine to go. Do Snehapana is a very good analogue that happens. Like a lot of complications are going on.
One of the questions, sir, can we advise Achapana when they can't take such high doses, but there is a necessity to do so? If not, what is the alternative we can suggest?
And if they are not in a position to take Achapana, don't try it. It will end up in a tragedy. Go
so
with
better to go for Vicharna.
Yeah, go for Vicharna only. That is the guidelines also. It is for the sake of patient only, it's not for our satisfaction. Save the patient.
Exactly.
Vicharna, advice Vicharna. That's good. Then doctor.
Otherwise, it will be like the surgery was great, the patient died. That kind of situation will happen.
Well, I didn't get surgery.
Doctor, the next question is.
Yeah.
No, sometimes, we say this surgery was great, but the patient died. So there is no point in forcing it if the patient is not ready for it.
Yeah, true. Actually, exactly. Then, next question.
There's one question by Dr. Shilpa Deshpande. Should the...
Yeah. What is the question?
Should the buttermilk be warm?
Buttermilk? No, it should not be warm.
Okay.
Buttermilk should not be warmed. It's routine. Fresh buttermilk.
Okay.
Only condition is very fresh. Don't purchase from outside. You can flavor it. You can add some salt, little that leaf and all, a ginger. You flavor it. That's all. Butter should be removed completely.
Sure.
Please.
And then the next question, in Vata Prakriti patients, whether we can start Grita without starting Rukshakriya. I think you answered that question while discussing about the M&D diseases, but this is the question as well.
Minimum, some sort of minimum level of preparation is needed, even in Vata dominant, Vata Prakriti, extremely emaciated patient also. In such condition, we give Divina Pajana medicines only. No need to give Udvartana and all. Even after 1 day, 2 days, Udvartana you can give. Generalized stimulation is always good. No? Some sort of total body stimulus that enhances Agni, gives a proper digestion and absorption of the Krita. Without Purvarma, Brahmanan, without Purvarma, Snehapana will never achieve the purpose. Okay, doctor. Next.
Thank you, sir. The next question, sir, you told by Dr. Sadanand Patil, sir, you told Snehapana up to Samyak Snigdha. Is it same for Sankleda Janya Vyadis too?
True, definitely. In Sankleda Janya Vyadi, we get an early Samyak. And that symptoms are most important. Based on the presentation of the patient, we focus on the symptoms. The disease-specific symptoms are more important. In Sankleda Janya Vyadhi, if we are again continuing, that will go to Adhisnigdha Lakshana. So we have to stop in between. Okay.
All right. So the next question, sir, this is by Dr. Mohan Kumar. His question is, sir, you mentioned total bed rest is has been mentioned during Snehapana, but is it against the concept of Diva Swapna? What if patient go to sleep?
Bed rest doesn't mean Swapna. No, never allow the patient to sleep. No, once the patient is sleeping in Panchakarma, Purvarma, during the process, sleeping is absolutely mana kiya hai. Never allow, even in Dhara. In many states, I have seen what they consume that during Dhara, if the patient is sleeping, good result is. It is not like that. Patient never sleep. Snehapana also patient never sleep. Let them lay down. Only point what I want to tell is while movement, the motility will increase. That may lead to vomiting or loose motion. That is the only thing. Ask him to lay down. That's all. No need to sleep at all. Never sleep.
Maybe they have to fall in love with boredom of being idle.
Yeah, that's all. Fine.
Then we'll take some from the other one. Sir, kindly share your experience of Snehapana with Ballataka Krita.
Ballataka Krita. Is Ballataka Krita? Yeah, Ballataka Krita.
Yes, Ballataka Krita, sir.
We have a study on Ballataka Krita that is in Alzheimer's disease. And which Ballataka? We prepared the Ballataka, only Ballataka is there, no other combinations. Only single drug in ghee, never prepared like that of Snehapaga. You know, in Nellinanda,
the rice seed, husk.
Paddy. So
you mean the husk?
No. Some old houses there is a storage space for paddy. A big wooden storage space is there. We put the Balladaga in the Grida and kept inside the storage, in between the paddy. That was only temperature. This is the direction for preparing Balladaga Grida. That is told in Rasayana, Shaharda Rasayana. We used for Alzheimer's disease that day. No, there was no much result as expected. People are telling now attention is there. They are listening to the TV. They are a little conscious. Like they are happy. I am not at all happy at all. Because that was a Shamana type of Snehapana. That study, if the dose was increased, if there was a Purokarma, could have been given better result. I think so. In Vadarekta is ideal drug. If Balada is not sensitive, it's a wonderful drug in Vadarekta. Vadarekta means it's rheumatoid arthritis.
Yes.
Your language means from outside Kerala, it's rheumatoid arthritis. In rheumatoid arthritis, Balada gives wonderful result. Shamana typos. It's a bedtime. You give 50 milli. That's enough. If Balada is not sensitive. In arthritis also is good. Balada is it's the Rasayana best drug for Vada. Same is Medhya also. That is the beauty of Balada. Medhya is working. Please.
So next question by Dr. Surya KP. Sir, in a Shita Pitta patient on the third day of Snehapana, the complaints aggravated as in Kandu mainly. Why it may be due to kindly elaborate?
And that is a wonderful situation. Kandu has to aggravate. All the patches has to aggravate. Then only dosha is vitiating. Kandu is because of kapha. Now after Snehapana, kapha increased. That increased kapha leads to Kandu. It's fine. In such condition, you can go for Vamana or Virejana. Okay, sir. It's only because of the vitiated kapha it happens.
Can there be some symptomatic relief that can be done?
Vada symptoms will subside. Means what can be done?
Yes. Some symptomatic relief can we do some symptomatic relief if the Kandu is aggravated?
You are asking about management.
Yes, during the third day of Snehapana, if Kandu has increased, is there
If bowel is okay, there won't be any problem.
relief that can be done to, because the patient can feel very agitated.
Yeah, that is true. If bowel is there, you always observe. See, during Snehapana, Vadanalomi is most important. If constipation is there, in many Snehapana, it is observed side by side, constipation is increasing. That is a reason for Kandu also. So in such condition, better we change the grida. The medicine we change is a little more Vadanilomia drugs we use. If constipation is solved, then Kandu will come down. No need to give any Kanduhara medicines. In utter conditions, some external they can use, but not the oil preparations. They can use some dhara. Any type of kashaya dhara is good. That gives a temporary relief only, not a permanent relief. Shamana medicines, as far as possible, avoid Shamana medicines because our intention is to make Vriddhi Abhishandana of the dosha. That time when we go for Shamana, that will come down. Shoshana happens.
Okay.
Again, depends on the patient. No? If it is not possible to continue, we have to do some medicines. Stop one day, do one Virejana, that will come down.
Okay.
Okay, sir.
So we'll take one more question as we are running out of time. What might be the condition of Koshta at the end of Snehapana? Are we making the Koshta mrudu through Snehapana?
Definitely. Whatever maybe is dosha, whatever maybe, that I told in between, Snigdha Bhava is increasing. A Koshta became mrudu means the dosha is not there. Vada dominance is not there. The entire body, entire cells, entire srodhas, Snehamaya, Snigdha Bhava is coming. So that true represent in Koshta also. Before Panchakarma procedures are intended in Madhyama Koshta for a smooth running of the Panchakarma. In Mrudu Koshta, Vamana, Virejana, whatever we do have some limitations in terms of the dose of the medicine. Otherwise, that will end up in some complications. So Snehavana definitely lead to a Mrudu Koshta. So after Snehavana, next few days, that will recover, come back, not to Pura Kosha, it is to Madhyama Kosha. That is true. That is happening there. It's a transition effect only. Only because of Snehamana, no one can change their Kura Kosha to Mrudu Kosha. That is a Prakriti. Kosha is the Prakriti one. No? So disease-based changes in Kosha can be managed with Snehamana. Otherwise, it won't. Okay, sir.
Thank you, Dr. We actually have more than 40 unanswered questions, but we really are running out of time. We will take down these questions. As you all know, whoever has registered for this, you will get the notes of this webinar and also the recordings of this. We will try to take all the questions and we will get you the answers for that. Now we go to the Managing Director, Dr. Ramanathan sir, for the vote of thanks, and then we will finish this webinar.
So thank you, Dr. Manoj.
Thank you, sir.
A
Thank you.
very good afternoon, because now the time is 12 o'clock. You are maintain the correct time also, sir. Thank you, sir. 12 o'clock. So that is why I'm doing a good afternoon to one and all. Let me begin my congratulations and thanking Dr. A.K. Manoj Kumar for that enlightening discussion on the concept of Snehapana. Thank you, Manoj. Very wonderful class. This
Thank you, sir.
is and which you have explained the logic behind the choice of Sneha, method of administration, matra, assessment of Samyak Siddha, Lakshana, etc. will greatly benefit the beginning and the expert practitioner alike. It will definitely inspire confidence in practitioners to utilize the highly effective Snehapana therapy in his or her daily practice and enjoy the immense benefits. The Sitaram Research Foundation wishes to further its core values of fashion, innovation, and excellence to young and upcoming Ayurveda practitioners through the series of CME named Ajara Rasayana. With the Indus tagline, the great practitioners invest in learning. Dr. Manoj Kumar, with 22 years of the teaching behind him and presently on deputation as a registrar of the Kuhas, is indeed a stalwart in the field of Ayurveda, and it is an honor to have him here with us today. At Sitaram, we have committed towards promoting and upholding the classical line of treatment and medicine, the essence of our system, and Dr. Manoj Kumar, who is a dear friend to me, he is a person to actively campaign for his cause. Dr. Manoj, it is my first experience. The 235 participants are participate this webinar. Still the moment, nobody is left. That is a beautiful for your classes, sir. Otherwise, everybody is left the classes. But 1 hour, 35 minutes, you are full people, all the attendees, you are catch the mindset. Congratulations, congratulations,
Thank you.
sir. Your experience. Thank you, sir. I am one more. I tell you, all the attendants are here. The Manoj Kumar is a present registrar of Kuhas. He is a no single point still the moment. Any complaint against the registrar. This is the first experience of the Kuhas. Thank you, Manoj. You are maintaining how you are maintaining this a wonderful post. The present Ayurveda and allopathy crisis area. This is a wonderful. I think you are an effect also. Your mind also. It's very good effective of this management also. Thank you, sir. As we are remark upon our 100-year legacy, we have invite you, one of you, on the exciting journey of learning, discovery, and healing. I extend my sincere thanks to all the participants and coordinate of this webinar series. You, sir. Thank you,
Thank you, sir. Thank you, sir.
Manoj, for your beautiful one. Vignesh, what is the
Thank you
next
so
class?
The next class is by Dr. Vasudevan Namburi, sir. The class will be on the topic of Vada Shonita and how to utilize the concept of Vada Shonita in our day-to-day practice. And once again, sir, Dr. Manoj Kumar, sir, thank you so much. It was a very enlightening talk. I mean, we got so many practical aspects. One of the main key points that I understood was, as a practicing doctor, we tend to give up Snehapana the moment we see that the patient is undergoing a tough time, or when they are vomiting or feeling unwell, we somehow stop it. But it is really an understanding that we have to, no matter what happens, we have to make it till Samyak Snigdha Lakshana. And we can see with the response, we all are attained Samyak Snigdha Lakshana with your presentation. And thank you so much. And to all the participants, we will be giving the notes of this webinar so that you can use it in your practice. And please do send us a review of this webinar to the email. And if you have any topics that you would like to be discussed for the webinar, please do send us. So in the next series of the Acharya Rasayanam, a very important aspect of our enhancing our practice, we will try to include that. Thank you all, and see you next Sunday on the topic of Vada Shonitam. It will be a very interesting topic.
Thank you.
Thank you all. Thank you.
Thank you, Manoj. Thank you.
Thank you, sir.
Thank you, Manoj.